Okay, let me share with you my impressions of Toby's case and then the treatment plan that I want to perform with him. So, I have a bunch of concepts in the impression sections. Let me read those to you and then I can kind of elaborate on each one of these paragraphs. So, Toby's chief complaints include chronic gastrointestinal symptoms of maldigestion and bloating. He has had 3 positive breath tests for small intestine bacterial overgrowth. Despite this pattern, he has regular bowel movements daily, and there are no findings associated with progressive injury of the enteric nervous system. Previous lab tests indicate inoculation with Blastocystis hominis in 2021 and Amoeba fragilis in 2019. It is possible that these parasitic inoculations may have some contribution to his chronic gastrointestinal symptoms, but are unlikely to be the sole cause of his gastrointestinal symptoms due to aggressive protocols to support his gastrointestinal tract that he has conducted over the years. Although these parasitic infections cannot be ignored, there's a strong possibility that they may have brain-gut axis dysfunction associated with chronic traumatic encephalopathy. At this time, further exploration into his pattern of CTE should be investigated since he has conducted an exhaustive list of gastrointestinal therapies. Okay, so let me comment on a few things. First of all, you have to realize he's had chronic gastrointestinal complaints since he was in high school. So these parasitic infections just showed up in 2019 and 2021. Sometimes when someone has a dysfunctional gut, the gut immune system gets weak, their SIGA levels get weak, and they start to have inoculations. So these parasites can sometimes be a distraction. Lots of people have these parasites have absolutely no symptoms. And for some people, if you test them with no symptoms, they show up with parasites. And once their gut immune system gets weak, that's when they start to have a lot of gastrointestinal problems. But whatever's causing the underlying gastrointestinal patterns may be a factor. So, you get totally distracted in just trying to go after these parasites and really waste a lot of time. Of course, they can be treated at some point, but it's probably not something that's causing him ongoing issues. Because he's had them prior to 2019 and 2021 with previous tests that showed no findings whatsoever. So that's one thing to really think about and consider. And he's also done very aggressive protocols to treat parasites in pigs multiple times in his history. So something to be aware of. Now, in the Krasian Institute to do GI course that we put together, that there's a whole section on non-responsive gastrointestinal issues. There's always a possibility of like chronic intestinal autoimmunity or someone who's got undiagnosed celiac disease. There's a whole list of things like neurodegeneration of the gut. Obviously, at age 28, we don't think he's got neurodegeneration of his gut. We don't really think he's got celiac disease that's causing all this. He's already been on a long-term gluten-free diet, so it's not just that simple. But he does have like some very strong clinical indications of trauma to his brain, and his examination also showed very clear dysfunctions in certain areas. If you notice, he had dilated pupils and a sympathetic mode all the time, and he gets limbic throughout the day. So there may be some dysfunction in the brain-gut axis. His gut sounds were a little bit they were on the borderline. They weren't very clear one way or the other, but his palate was a little bit sluggish, so it wasn't as clear with those things. But dilated pupils and all the symptoms he has related to brain function or things that we may suspect he may have a brain-gut axis disorder. Now, second paragraph. Toby has a history of multiple head traumas while playing high school football and reports of having 4 separate concussions during his high school career. There is a clear timeline of his head traumas and development of gastrointestinal symptoms. So no GI symptoms, head trauma, and then GI symptoms start to develop. He also reports daily patterns of brain fatigue, especially when double tasking, that lead to limbic presentations. Limbic is just the emotional responsive brain. These limbic presentations involve impulse control problems, aggression, anxiety, inability to tolerate noise, and difficulty with healthy social interaction. These limbic presentations are the early signs of CTE and cannot be ignored. His limbic patterns seem to express with excessive double tasking and executive functions that occur during his daily work demands. So this is a big issue, like 4 separate concussions where it's very noticeable and there's a problem. in high school, and then that timeline is direct to where the GI symptoms start, uh, strongly suggests that there may be some brain-gut axis disorders from brain injury. Now, when people get chronic traumatic encephalopathy, the inflammatory response keeps going. And one of the earliest things is they get these aggressiveness behaviors, impulse control, anxiety. They can't tolerate noise. And Toby's a really good guy. He's a really nice guy, and he's frustrated when he has these symptoms. So whether the brain-gut axis is part of his chronic GI issues, we really need to look at some interventions to improve his brain function and to prevent ongoing progressive neuroinflammatory issues. So, we think the gut issue, I think the gut issue may be related to potentially a brain-gut axis disorder, but even if I'm wrong, it's still critical to really look at improving his brain health and brain function so we can change these symptoms and hopefully reduce some of the negative expressions of forced separate concussions and many other head injuries he's had as he gets older. Okay. Neurological evaluation identified clinical symptoms associated with injury of the prefrontal, dorsolateral, orbitofrontal cortex. Those are from the brain region localization form. The daily symptoms include difficulty planning and organizing, difficulty making decisions, difficulty initiating and finishing tasks, and difficulty staying focused and concentrating for extended periods of time. The neurological examination identified any deficits associated with motor sensory or autonomic regions of the brain. So we know he's got all the different clinical symptoms associated with these areas of the brain being injured. If you look at the brain region localization form, we can see, things marked 75%, 100% of the time associated with the areas of function here. And, usually with football players, athletes who have direct contact, it's usually the front of the brain that they end up hitting and injuring in their careers. So we see some of that clinical symptoms of that. Now, Toby is a successful entrepreneur. He has his own business, and he's basically using these frontal lobe, prefrontal area, dorsolateral orbitofrontal functions. These areas of the brain are the front of the brain. They're basically executive functions of the brain. So he's using those on a daily task, and if he does a little bit too much, he gets a little bit limbic. And this is where we see some of these, aggressiveness and impulse control and inability to tolerate noise really come out. I also wrote, in normal circumstances, injury to the prefrontal cortex may recover with executive and cognitive tasks that Toby is engaging in during his work-related tasks. So, a lot of times if you injure an area, if you activate the area, it can recover. And his work, planning, organizing, doing different tasks, or actually activating the area that is injured. However, it seems that he is exceeding his prefrontal cortex metabolic rate daily, which is leading to patterns of becoming limbic due to impairment of prefrontal cortex inhibition of limbic circuits of the brain that lead to increased physiological stress response and healthy sleep. So let me just explain that in more detail. So the way this works is the areas of the prefrontal cortex activate centers in the brainstem that dampen the sympathetic response. So the healthier your brain is, the greater ability you have to dampen the sympathetic response. So when you look at someone who has brain injury, sometimes their heart rates are really high, they have dilated pupils. We saw that with Toby. Even his blood pressure is high. So he may even have some patterns of neurogenic hypertension, we suspect, with him. And when the brain isn't able to dampen sympathetic responses, that can increase issues with sleep and an exaggerated response to stress, which he has. And the cortex also activates inhibitory pathways to the reticular activating system so a person can fall asleep. So I think he's potentially stuck in this cycle. Now, when you have an injury to the brain, those neurons are not healthy, and those neurons don't have enough mitochondria, and the surrounding neurons may just not be efficient in their functions. So areas of the brain that are injured tend to have much less endurance. So what we're seeing with him is, like, he does his daily activities, his brain fatigues, and then he gets these limbic responses. And these limbic responses, then these are autonomically sympathetic. And then, if you have increased sympathetic responses, you can't have ideal parasympathetic. And these are so-called dysautonomia patterns that happen from traumatic brain injuries, TBIs, and they can absolutely cause chronic gut issues. So this is a possibility here. Now, we may not be able to recover his brain. We may not be able to fix his gut issues, but because you never know what degree of injury a person has. But we have to see if he responds to it. If his brain function starts to change and he starts to improve, and this diagnosis of brain-gut axis disorder is accurate, then we should see his gut symptoms improve as well. And also, if his brain doesn't improve, and those brain functions don't improve, we may not see any change in his gut if there is a great brain-gut axis problem. Okay. Now I go on to say that furthermore, there appears to be clinical signs of impaired circulation associated with reduced nitric oxide activity that include mild hypertension. He's got actually stage 2 hypertension, poor limb circulation, and an ankle brachial index of 0.92. And those are early patterns of peripheral arterial disease. So he's got stage 2 hypertension and early patterns of peripheral arterial disease. The ankle brachial index is basically just checking his blood pressure in his arms and then his legs, and then look at the ratio between his arms and legs, and 0.92 is an early pattern of this peripheral arterial disease, which means he's getting plaquing in those peripheral vessels. Topi has difficulty recognizing temperature perception in distal hands and feet due to the significant impairment of circulation. You can see he couldn't perceive cold temperature all throughout his hands. His circulation was so bad. Clinical strategies to improve his physiological patterns of brain recovery, reduce neuroinflammation, improve sleep quality, optimize nitric oxide, and vascular health will be incorporated to determine if there is any impact on the strategies on both his brain function and his chronic gastrointestinal symptoms. Several phases of treatment will be incorporated in order to address this pattern of neuroinflammation, brain injury recovery, and potential parasitic inoculations. Now, if you look at his case, and you look at the courses we have at the Cross Institute, this is going to be a combination approach of taking principles from the neuroinflammation course, taking principles from the gastrointestinal course, taking principles from the fatigue and pain course, especially related to mitochondrial health, and trying to blend those all together. And that's why it's so important to look at case studies and not just look at seminar information, because seminar information gives you background of principles and concepts related to a specific topic in clinical practice. But in real clinical practice, you have overlap between many of these different concepts together, which are important. And also, we can also look at all the information presented in the cardiovascular course, since we got to figure out how to get his hypertension down, start changing his peripheral arterial disease, and seeing what else is there. So there are some labs that I recommend, and a lot of these labs have to do just with his hypertension, his signs of poor circulation, which means his nitric oxide pathways are off. Remember, he's only 28, so he can have some severe cardiovascular disease if we can't change this for him. And if we look at the patterns, so initially just a typical metabolic panel, 14 CBC with differential vitamin D, thyroid panel, iron panel, those are all just routine markers. Now, ones that are really important for us to look at is cardiovascular health: homocysteine, C-reactive protein, fibrinogen, TMAO, oxidized LDL, apolipoprotein assessments, matrix metalloproteins, NMR lipoprotein particles assessments, heavy metal profiles, red blood cell magnesium, methylmalonic acid, and then want to see if he has any H. pylori issues. Remember, H. pylori can cross-react and destroy the vascular endothelium or burrow into the lining of the vascular endothelium and cause some destruction. And just with all routine blood work, I always do a routine urinalysis. Additional imaging, special studies, coronary artery calcium scan, see if he's got any atherosclerosis. He really has some signs of peripheral arterial disease. That blood pressure does not go down, and I think his blood pressure is neurogenic hypertension. He's going to keep damaging those arteries and those blood vessels. He's going to end up with severe atherosclerosis in his limbs, where he's going to have pain walking and start to get, different lesions in his feet that are not going to heal and have all types of problems the next 10 to 20 years, and he may even get enough atherosclerosis where he's prone to a stroke or even early heart attack. This is the basic pattern of someone who looks fit, healthy, they're 28, and then they end up with like a heart attack or stroke by the time in their 40s. This is that patient. So we really got to really focus on these things. Even though Toby's main chief complaints are like, hey, I've got a gut that's not working, this stuff can't be ignored. This is very serious. So dietary recommendations. A ketogenic diet was recommended to optimize fuel for the brain, mitochondria to dampen microglial neuroinflammation. And ketogenic diets, by the way, even though they're a high-fat diet, they're high healthy fat diets, and numerous studies and even meta-analysis have shown that it reduces cardiovascular risk dramatically and lowers lipoproteins and LDL and inflammation and insulin. So it's cardioprotective, even though it's a high-fat diet, but it's really high fat with very low carbs, and it's the low carbs that really make the protective impact of stopping inflammatory responses associated with insulin. Lifestyle recommendation: identify lifestyle patterns with sleep, diet, breaks during work, frequency of meals and tasks, load to prevent limbic patterns. Limbic patterns are classified as symptoms of aggression, intolerance, noise, impaired socialization, fatigue, and brain aggression. So basically, we got to stop his brain from fatiguing, because if the brain fatigues, then you get sympathetic releases, and you get limbic, and he gets aggressive, and he gets sensitive to noise and sound, and that can disrupt his gut function, that can disrupt his microbiome, and it can increase his blood pressure. So he's got to figure out how to keep his workload healthy enough so he doesn't get limbic. As his brain gets healthier, he can have more mitochondria efficiency and more mitochondrial biogenesis, or more mitochondrial quantity, and then we should see if those things can change. So neurological exercise recommendations. There were no neurological exercise recommended. His daily tasks of executive function with work provide enough stimulation for neuroplasticity, mitochondrial biogenesis, and nerve growth factor release, support recovery of prefrontal cortex. The main issue at this time is to not exceed his metabolic rate of endurance in his prefrontal cortex during the day and allow for patterns of support recovery. So like if an area of the brain is injured, let's say a person has some injury to the motor regions of the brain, they can't move their arm up after a car accident. Well, you can do all types of things, but unless he actually starts to activate moving his arm up, he's not going to get those neurons to reconnect. So the rule of neurological rehabilitation is whatever they can't do, you have them do. Now with him, it's really his executive function area that's involved, his prefrontal cortex, and all the things he's doing at work is really activating it. So even though he's got an injury, he's doing what he can't do, or he can't do over a period of time with endurance. So we just got to make sure he doesn't exceed it. Just like an athlete, if they overtrain, they're going to get injured. Well, if the brain doesn't have enough endurance and it gets exceeded that pathway, and then it gets limbic, then it's going to really create an ongoing environment with him where he can't recover. So the goals of clinical management: identify lifestyle strategies such as not missing meals, ketosis, exercising in the afternoon, taking breaks during work, etc., in order to not develop limbic patterns in the evening. So this is just from us talking, if you remember from the history, and trying to figure out what he can do so he doesn't exceed his brain's metabolic rate and get limbic, like all nervous and anxious and so forth. Associate between limbic activity and persistent gastrointestinal symptoms. Specifically, we want to see if there's a resolution of gastrointestinal symptoms as limbic patterns are no longer expressed from prefrontal cortex fatigue. So we want to see if he stops getting limbic and aggressive and loses his temper and can't handle sound or light and can't handle movement, being around a lot of social interactions. When that starts to resolve, does he still have GI symptoms, or is there a big change in his gastrointestinal function when that occurs? Does his blood pressure go down? Right, so those are the things that we want to evaluate. Okay, so treatment plan, phase 1. Perform a ketogenic diet, get into a state of ketosis, confirm ketosis by measuring serum ketones, avoid states of low ketones, hypoketonemia by eating frequency and using MCT oil. So even though people get into ketosis, sometimes their ketone levels drop and they end up losing function, just like people that have hypoglycemia do, but in the ketosis state, it's hypoketonemia. So you want to make sure you use MCT oil throughout the day. Keep a journal of morning and nighttime blood pressure. Develop a daily routine that does not exceed prefrontal cortex metabolic rates and leads to patterns of becoming limbic. Perform a coronary artery calcium test. Complete laboratory tests determine his general metabolic function and cardiovascular risk factors. Those labs are all listed up here earlier. And then nutritional strategies to reduce neuroinflammation, resveratrol, tumoractive, and trisomal glutathione. So these are all products from Apex Energetics. But basically it's liposomal resveratrol, transresveratrol, liposomal high curcuminoid activity of turmeric, and liposomal glutathione in both L-glutathione and the acetylglutathione form. So very, very, very good, high absorbable amounts of flavonoids and antioxidants to dampen neuroinflammation. Nutritional strategies to increase nitric oxide levels to improve circulation in blood. Neuro 2 capsules and nitric balance, which is a liquid. And basically the formulas are similar, but one's in a capsule form, one's in a liquid form. There is compounds in there that help activate, have been shown to activate endothelial nitric oxide, like ginkgo biloba has been shown to do that. Vinpocetine has been shown to do that. So the product contains some of these ingredients that have some of those activities. So whenever we see someone's got really bad circulation, really poor blood flow, we try to use formulations like Neuro 2 nitric balance that have things like ginkgo biloba and vinpocetine and those compounds in there, as well as Synergist, to support those pathways. And then send weekly emails regarding following updates, morning and nighttime blood pressure readings, ketone measurements, number of days per week, limbic patterns develop. So this is all phase 1. Then phase 2, once ketogenic adaptation can take its place, experiment with time-restricted feeding if it does not cause increased susceptibility to brain fatigue or limbic expressions. And we just want to get him to the point where he can start to get rid of some of the debris in his brain. So go from time-restricted feeding eventually into maybe even some longer fasting periods to help with autophagy. Recheck serum estrogen, history of high estrogen in the past levels, and any previous abnormal lab markers conducted in phase 1. So we got to wait to see what happens when we get the labs back. At some point, we got to recheck those and reevaluate gastrointestinal symptoms, determine if interventions to treat gastrointestinal pathogens need to be considered. So we have a lot to do here. Obviously, even though he's here for his chief complaint of gastrointestinal issues, we can't ignore the fact that he has the early presentations of chronic traumatic encephalopathy, all the symptoms of it, all the patterns from his history that suggest he may have some of those issues. And we also are really concerned about his vascular health, since he's got, stage 2 hypertension, and he's got a ankle brachial index showing early patterns of peripheral arterial disease and really bad circulation in his limbs. So those are the key concepts, kind of the wrap-up of his case, and then the treatment plan that I've put together for him. We'll have to see how he does. We'll probably make some adjustments and shifts depending on how he responds. This will definitely be a process, and we'll have to see how he does over time to see where we end up going and if we need to make adjustments along the way. Okay, thank you for your attention.